Thank you. So for prevention of Alzheimer's and Parkinson, where does exercise, and exercise means aerobics, it also means resistance weight training, where does that fit into this?
Well, I'd like to answer that if I may. Brain-derived neurotrophic factor is increased by exercise. And brain-derived neurotrophic factor allows us to produce more brain cells and more connections between our brain cells. There are other trophic factors too. So this is one of the ways that exercise does that. And exercise, of course, has been found to help tremendously in Parkinson's disease, not only prevention, but in assisting people with Parkinson's disease experience fewer symptoms.
Yeah, absolutely agree. And you know, multiple mechanisms here, because you do create more insulin sensitivity with exercise. That's one of the things that actually is the benefit. As Steve said, of course, you increase your BDNF. Most studies show 10 to 12%, that sort of increase. And of course, there are other things like whole coffee fruit extract that have been shown to increase it as well. Lots of people are interested in increasing BDNF in Alzheimer's disease. Of course, improved blood flow, improved oxygenation, improved sleeping. So absolutely, by multiple mechanisms, when it comes to Alzheimer's disease and pre-Alzheimer's, and that's of course one of our big problems, we diagnose this so late. We call mild cognitive impairment is a relatively late stage of this problem. So this is one of the big problems. In fact, we diagnose it so late, but absolutely exercise plays a huge role in best treatment and best prevention.
I agree.
And Ray, could you say something about what have you seen with effects of exercise? Because certainly there's been a lot discussed. Dr. Zid and his program, for example, and others. What do you see with exercise in your Parkinson's patients, and Dr. Blake as well? What do you see?
So as Dr. Blake was indicating, it's helpful to lower your risk of Parkinson's. So vigorous exercise in your 40s, 50s, and 60s can decrease your risk of ever developing Parkinson's by about 20%, equivalent to 3.5 to 4 hours a week of running or swimming. And then numerous studies have demonstrated the benefits of exercise for people with Parkinson's disease, everything from boxing, where you actually don't have to hit people in the head, but you do vigorous exercise, bicycle riding. A study done in the New England Journal of Medicine showed that Tai Chi improved balance and decreased your risk of falls. Yoga, dancing have all been shown to be of great benefit for people with Parkinson's.
And what does it do for your GDNF?
So we're still trying to figure this out. So I think people have to understand that the brain's not so easy to do an assay of. It's hard to assess. You can't go in the brain and see how it's doing, as opposed to like doing an ultrasound of the heart, and you can see how the heart is functioning. But as Dr. Blake and you were both indicating, it appears that exercise releases growth factors that are protective to nerve cells and maintain synapses that are important in both Alzheimer's disease and Parkinson's. And then my colleague and co-author, Dr. Boss Bloom, just reported some results looking at functional imaging changes in response to exercise that might be suggesting that connectivity might be improved, as suggested by both of you.
Exciting.
It is important that we caution people with Parkinson's disease to get their exercise in a safe manner, because falls are so easy with Parkinson's disease. There are devices that hold people up, say on a treadmill, so they can get some good exercise without any chance of falling whatsoever. So just be careful when you start an exercise program, both for cardiovascular and for falling. Thank you all. It's been a pleasure.